Hello, welcome to Mr. Question Channel. If you're a parent listening, you've probably heard about this walking pneumonia going around,
Yeah.
especially with kids. It seems like the last thing we need is something else to worry about, right?
Right.
So we're going to take a deep dive into it today, and we have an expert to help us understand it all.
Thanks for having me. I'm happy to be here.
So first off, what exactly is walking pneumonia? The name's kind of confusing.
Yeah, it can be a little misleading. Basically, walking pneumonia is an infection
Right.
caused by a bacteria. It's called Mycoplasma pneumonia,
Mhm.
and it affects the respiratory system. But the thing is, unlike regular pneumonia, which can be pretty serious, walking pneumonia tends to be milder, hence the name walking.
Okay, so that's somewhat reassuring,
Yeah,
but I'm guessing it's still something we need to take seriously.
absolutely. Even though kids with walking pneumonia can usually still, walk around
Yeah.
and do their normal activities, they can still feel pretty lousy.
Mhm.
And it's important to manage it properly to prevent complications.
Yeah, for sure. And we're hearing about a lot more cases lately,
Right.
particularly in younger kids. Is this like a post-pandemic thing?
I think that's definitely playing a role. These infections tend to go in cycles.
Okay.
And after the pandemic, with all the isolation and precaution, kids haven't been exposed to as many germs, so their immune systems may not be as prepared now.
Interesting. So it's like their immune systems need a workout to stay in shape.
In a way, yes. Plus, we also have better diagnostic tools these days,
Mhm.
so we might be picking up more cases that were missed in the past.
That makes sense.
Yeah.
So how can we tell if our kid has this thing?
Yeah.
What are the signs?
Well, the tricky part is that the symptoms can be very similar to a cold or even the flu, especially at first.
Oh, okay.
So you might see things like cough, fever, headache, fatigue, maybe a sore throat.
So pretty much the usual suspects when a kid gets sick, right?
Right.
What's different about walking pneumonia?
It's all about the timeline. Unlike a cold or the flu, which hit you pretty suddenly, walking pneumonia tends to come on more gradually, over a few days or even weeks. And those symptoms, especially that cough, can linger for a really long time, sometimes even months.
Months. Okay, so a cough that just won't quit, that's a red flag.
Exactly.
Anything else we should be looking out for?
Well, in younger kids,
Yeah.
they might not always have the typical respiratory symptoms right away. Sometimes it's more tummy troubles like diarrhea or vomiting, or they might just be extra fussy and irritable.
Ugh. Yeah, I've been there. It's hard to know what's really going on with toddlers sometimes. So we need to be extra vigilant, especially if those symptoms just keep dragging on. And when it comes to treatment,
Yeah.
are we talking antibiotics here?
Usually, yes. Antibiotics, specifically a type called macrolides, are the first line of defense. They're very effective against Mycoplasma pneumonia, but the important thing is to complete the full course as prescribed.
Right, we don't want to mess with antibiotic resistance.
Exactly. Even if your child seems better before finishing all the medication, it's crucial to keep going.
Okay, good to know. And apart from the antibiotics, what can we do at home to help our little ones feel better?
Well, rest is absolutely essential. Make sure they get plenty of sleep.
Yeah.
Keep them comfortable. Maybe set up a cozy spot with their favorite books or movies.
Quiet time is good.
Definitely. And hydration, of course.
Always a challenge with sick kids.
Yeah.
Any tips on the food front?
I know. Sometimes you just have to get creative. Smoothies, soups, even popsicles can help with hydration.
Popsicles, that's a good one.
And a humidifier can be really helpful for easing that cough, especially at night.
Oh, those are great tips. Very practical. I'm all about simple solutions when my kids are sick.
Me too.
So we've talked about symptoms, treatment, what to expect if our child gets walking pneumonia.
Right.
But the million-dollar question is, how do we prevent this in the first place?
Well, the good news is that a lot of the same strategies that work for other respiratory illnesses apply here. Frequent hand washing, covering coughs and sneezes.
Easier said than done with kids.
I know it's a constant battle. You can try to make it fun.
Yeah.
Maybe sing a silly hand washing song or use a timer. And then beyond that, maintaining good overall health is key. A balanced diet, regular exercise, enough sleep, those all play a role.
So all the stuff we're supposed to be doing anyway.
Exactly.
Good reminder. Now, before we move on, I have to ask, when should we be really concerned? Like, when should we call the doctor immediately?
Yeah.
Any red flags?
You know your child best, so always trust your instincts. If you're ever in doubt, it's always better to err on the side of caution and check with your healthcare provider.
Good point. Sometimes we downplay our concerns as parents.
I get it. But some specific warning signs to look out for are difficulty breathing, persistent chest pain, a high fever that doesn't come down with medication, or any signs of dehydration.
Those sound pretty serious.
Yes, those warrant immediate attention.
And I guess any new or concerning symptoms that we haven't talked about with the doctor should also be checked out, right?
Absolutely. Always better to be safe than sorry.
Okay, good advice. So we've covered a lot of ground here today.
We have.
And I know it can feel overwhelming, especially when you're dealing with a sick kid.
Yeah.
But the key takeaway is that while walking pneumonia is on the rise, it is usually manageable with the right care.
Exactly. Antibiotics, rest, fluids, a little TLC go a long way.
Perfect. All right, we're going to take a short break here. And we're back with our deep dive into walking pneumonia. Before the break, we were talking about that recent surge in cases, and you mentioned that these infections tend to come and go in cycles.
Right.
And that the pandemic probably had something to do with it. Can you tell us a bit more about that?
Sure. So Mycoplasma pneumonia spreads through respiratory droplets, just like the common cold or flu.
Yeah.
And during the pandemic, with all the lockdowns and precautions, we saw a big drop in transmission of a lot of these respiratory bugs. Walking pneumonia was one of them.
Makes sense.
And that kind of created an immunity gap, especially in younger kids who weren't exposed as much as they normally would be.
So their immune systems haven't had as much practice fighting off those infections.
Exactly. Now that things have opened back up, these bugs are running into a lot more susceptible people.
Yeah.
So we're seeing these spikes in cases.
Interesting. It's like they're making up for lost time.
Right, exactly.
You also mentioned that better testing might be a factor. How so?
Well, diagnosing Mycoplasma pneumonia used to be a bit tricky. The symptoms are often really similar to other respiratory illnesses. And the tests weren't always that accurate, but now we have more advanced tests that can actually detect the bacteria's DNA.
Wow. Okay.
And they're much more precise. So we're probably finding more cases now that might have been missed in the past.
So it might not be that there are actually more cases,
Yeah.
just that we're better at spotting them now.
That's a possibility. It's hard to say for sure without a lot of data, but it's definitely something to consider.
That's fascinating. Are there any other things that researchers are looking into that might be contributing to this surge?
Yeah, actually, there are a couple of other areas of research I'd like to mention. One is the role of co-infections.
Co-infections, what does that mean?
It means getting infected with more than one bug at the same time.
Oh, yikes.
Right. And there's more and more evidence suggesting that being infected with one respiratory virus can actually make you more susceptible to getting infected with others.
So one virus weakens your defenses and makes it easier for another one to take hold.
Exactly. That's the idea.
Wow, that's rough. So co-infections are on the radar?
Yeah, it's still an area of active research, but it's something to be aware of.
Okay. What's the other area of research you mentioned?
The other one is environmental factors, particularly air quality.
Ah, so pollution and things like that.
Yep.
Could that really make a difference?
It could. There have been studies linking higher levels of air pollution to increased rates of respiratory infections, including walking pneumonia.
Interesting.
The thinking is that pollutants can irritate the airways and make it easier for bacteria and viruses to take hold.
That's concerning, especially with air quality being such a big problem in so many places.
It is. And it highlights the connection between our health and the environment. Taking care of the planet means taking care of ourselves, too.
Absolutely. Now, before we get into prevention strategies, is there anything else you want to add about the science behind this bug? I'm kind of curious about what makes this Mycoplasma pneumonia thing tick.
Well, it's a pretty fascinating organism. One interesting thing is that it's actually one of the smallest bacteria we know of. Yeah, and it doesn't have a cell wall, which makes it quite unique.
Wow.
And that also helps it evade certain antibiotics.
Interesting. So it's tiny but tough.
Exactly. The more we learn about these things, the better we can fight them and protect ourselves.
Speaking of fighting them, I know a lot of parents are wondering about prevention. What are the best ways to keep our kids from getting walking pneumonia in the first place?
A lot of the same things we do for other respiratory illnesses apply here. Hand washing, covering coughs and sneezes.
What, those basics?
Exactly. And trying to avoid close contact with people who are sick.
Always a challenge of kids.
I know, it's an ongoing battle.
It is.
But beyond that, a healthy lifestyle is really key. A balanced diet, regular exercise, enough sleep.
So it all comes back to those healthy habits.
It really does. And it's not just about preventing walking pneumonia. It's about supporting their overall health.
Now, one question I hear a lot from parents is about vaccination. Is there a vaccine for Mycoplasma pneumonia?
Unfortunately, there isn't a vaccine specifically for walking pneumonia. But keeping your child up to date on all their routine immunizations is still important, including the flu shot. That helps protect them from other respiratory illnesses that could weaken their immune system.
So it's about building up those defenses.
Exactly.
I'm wondering, with this recent surge, are researchers looking into developing a vaccine specifically for walking pneumonia?
That's a great question. There has been some research in that area. But developing a vaccine is a complicated process and it takes time.
Of course.
There are definitely ongoing efforts to understand the bacteria better and figure out how to target it with a vaccine.
So it's on the radar.
It is. And while we wait for that, the good news is that most cases of walking pneumonia are mild and they respond well to antibiotics by being aware of the symptoms, practicing good hygiene, and getting medical care when you need it. We can manage this illness and help our kids get back to feeling good.
That's good to hear. I think that'll put a lot of parents at ease.
I hope so.
Before we move on to our Q&A, is there anything else you want to add about walking pneumonia in kids?
You know, one thing that's really important to remember, especially with younger kids, is that they might not always be able to tell you how they're feeling.
Right. They can't always articulate what's wrong.
Exactly. So pay attention to their behavior. Look for any changes in their usual patterns.
So those subtle cues.
Exactly. If they're unusually fussy or lethargic or not eating as much as usual, those could be signs that something's wrong, even if they don't have a cough or fever.
So trust those parental instincts.
Absolutely. And if you're ever unsure, don't hesitate to reach out to your healthcare provider. They can help you figure out what's going on and make sure your child gets the care they need.
Excellent advice. Well, we're going to move on to our Q&A now and answer some of your most pressing questions about walking pneumonia. All right, we're back and ready to tackle some of your questions about walking pneumonia.
Yeah, let's dive in.
First up, this one comes up a lot. How contagious is walking pneumonia, really? Like, should we be keeping our kids home from school at the first sign of a sniffle?
I know, that's a big concern for parents, especially with school. The good news is that while it is contagious, walking pneumonia is generally not as contagious as some other respiratory illnesses like the flu or a cold.
Okay, that's good to know.
It mainly spreads through those coughs and sneezes, those respiratory droplets we keep talking about.
Right, so good hygiene is key.
Absolutely. And when it comes to school, a good rule of thumb is to keep your child home until their fever has been gone for at least 24 hours and they're feeling well enough to participate in class.
Makes sense. And of course, always check with your doctor.
Of course, always a good idea.
All right, another question's been popping up. How long does walking pneumonia actually last? We talked about those lingering coughs, but is there a typical time frame?
It can vary a bit from person to person, but usually symptoms last for 1 to 3 weeks. However, like we said before, that cough can really stick around for weeks or even months.
Wow, even after the infection is gone?
Even after the infection is gone, yep.
So the cough is really the thing to watch out for.
It can be.
What can we do to help ease that cough? Especially at night, it can be tough.
We touched on this earlier, but a humidifier can really help. You can also try elevating your child's head with an extra pillow that can make breathing easier.
Okay, good tips.
And for older children, honey can be soothing for the throat.
Honey is good for that.
But if the cough is severe or keeping them up at night, definitely talk to your doctor about other options.
Okay, good advice. Now, this is one I've been wondering about. Can adults get walking pneumonia? Or is it mainly a kid's thing?
Adults can definitely get it too.
Oh, okay.
It's just more common in children and young adults.
Interesting.
The symptoms are generally similar, but adults might experience more fatigue and shortness of breath.
So if it's going around the family, we're not off the hook?
Not necessarily, no. If someone in your household has walking pneumonia, it's smart to be extra careful about hand washing and hygiene.
Right. Makes sense. Yeah. Okay. Last question. This is the big one. How worried should we be about this recent surge in cases? Is this something to really panic about?
It's understandable to be concerned, but it's important to remember that even though we're seeing more cases, most of them are mild, and they respond well to treatment.
That's reassuring.
It is. By being aware of the symptoms, practicing good hygiene, and seeking medical care when you need it, we can manage this and help our kids feel better.
That's a great message. Knowledge is power, and knowing what to look for can make all the difference.
Absolutely.
Well, this has been a really informative deep dive.
It has.
Thank you so much for sharing your expertise with us today.
You're welcome. It was my pleasure.
And to all our listeners, we hope you feel more informed and prepared to deal with walking pneumonia. Remember, you're not alone in this. If you have any questions or concerns, don't hesitate to reach out to your healthcare provider. They're your best resource for keeping your family healthy. Until next time,